This is where we hold our, our AA meetings.
Ollie Treat knows all about the prescription drug abuse epidemic. He abused prescription painkillers for a decade.
Before I quit, I was taking 30 Lortabs a day.
Today, he's the executive director of the Howe Foundation. It helps men kick addiction to prescription drugs. Treat says he alone was responsible for becoming an addict, but he had to have doctors write prescriptions to feed his habit.
At the height of my addiction, I was going to 4 doctors a month.
Getting multiple prescriptions for narcotics from multiple doctors is called doctor shopping.
Prescription drugs have replaced the traditional illegal street drugs as the #1 drug of abuse in America.
Dr. Steve Nussbaum is an emergency room physician in Tulsa.
The #1 abused drug right now in the United States is oxycodone. It's not heroin, it's not cocaine, it's not even meth, which is a big problem here in Oklahoma, but it's prescription drugs.
In the past 5 years, the State Medical Licensure Board has taken disciplinary action against 38 doctors for overprescribing drugs. Of those, 3 had their licenses revoked. 2 agreed to no longer practice medicine, 7 voluntarily surrendered their licenses, and 15 had their medical licenses suspended. Anyone can make a complaint against a doctor to the State Board of Medical Licensure and Supervision. Most complaints originate with patients or patients' families. However, they aren't the only ones raising red flags.
I think we're seeing more complaints coming in from other professionals, pharmacists, other physicians, nurses, so on, when they see something that is unprofessional conduct.
The complaint against Dr. Kaufman is at page.
Every other month in its small, crowded meeting room, the State Medical Board hears cases against doctors accused of unprofessional conduct. Many involve allegations of overprescribing drugs. However, unlike some states, Oklahoma hasn't seen a spike in the number of overprescribing cases as the epidemic of prescription drug abuse has grown. But that doesn't mean Oklahoma doesn't have a problem with doctors that overprescribe. Lyle Kelsey is the board's executive director.
We see a lot of misprescribing, overprescribing, not necessarily just overprescribing, but improper prescribing, when they don't properly examine the patient and make proper documentation and diagnosis and then treatment.
Kelsey says the board has plenty of investigators, but admits it often takes months, even as much as a year, for investigations to be completed before a case is heard by the board.
I think part of the reason is that we're very careful to make sure that we meet all the requirements of clear and convincing before we take them in front of the board, and the board is very conscientious about making disciplinary decisions.
While the allegations are under investigation, they're not made public, and that's a two-edged sword. On the one side, it's to protect the doctor's reputation in case the allegations prove false. But if the allegations do pan out, all the time the investigation's been going on, that doctor has been allowed to practice medicine without his or her patients knowing there might be a problem. Allegations are made public when a doctor appears before the board for a disciplinary hearing.
The following allegations in the complaint.
This is the September 15th hearing for Dr. David Dawson. He's accused of prescribing large quantities of narcotics, sleeping pills, and anti-anxiety medications like Xanax to several teenage patients, some for months or years at a time, when he worked at Midway Medical Clinic in Midwest City. Dawson is no longer employed by the clinic. OBN investigators found some of the drugs he prescribed were sold on the street.
And you hear about somebody later selling the drugs on the street, you realize at the time that they weren't taking that many.
The board had its expert witness, Dr. Robert Jones, review Dr. Dawson's patient charts. In most cases, Dr. Jones did not find a signed parental consent form allowing Dawson to treat the teen or prescribe medications. Dawson claimed he had consent, but didn't know why the forms weren't in the charts turned over to the medical board investigators. Board members repeatedly asked Dawson if he warned patients about the addictive nature of the medications he prescribed.
And to be honest with you, I didn't go into a long, drawn-out discussion on the addiction potential on them.
Did you ask the parents that came in with the patients if they understood narcotics and Soma and Xanax are addictive?
Yes.
And that they wanted their children to have these for month after month after month for up to 2 years? and that there was a real risk of addiction? Did you advise the parents that came in with these children of that in every case?
Probably not in every case, but I relied on the parents to actually dose the medicine to their minor children.
But did you warn them of addiction, is my question. I'm just asking.
No, I didn't, but it says it on the side of the bottle when I get it from the pharmacy.
There is a course called Responsible Opioid Prescribing. To your knowledge, have you taken such a course?
No, I haven't.
Do you have any reservation, or would you change your plan of action, knowing what has happened and what you're being?
You mean after coming in here
Right now, yeah.
and being out of work for 8 months? I wouldn't prescribe another narcotic.
Dr. Jones, based on your review of the chart, in your professional opinion, do you believe that Dr. Dawson's treatment put the patient at risk of potential harm?
Yes. His practice does not meet the standards of care for the community. It does not meet the guidelines laid out by the board for the use of chronic pain medication.
And then I move, based on any and all of the findings, to suspend for 6 months.
Voice vote?
Sarah Judd and I.
Aye.